Next, I want to welcome Emily Chang, who's our melanoma pharmacist. Excuse me, I need to come closer to this microphone. Emily Chang is our melanoma pharmacist. We have dedicated pharmacists to work with our program, and she's going to talk to you about if BRAF MEK tablets targeted therapy is an option that you're considering along your journey. Thank you, Emily.
Thank you, Dr. Trong. But again, my name is Emily Chang. I do have 2 double H's. It's not a typo. But today I will be talking about managing your treatment on BRAF and MEK targeted therapy. Just a quick raise of hand. Has any of you currently on BRAF or MEK or BRAF plus MEK inhibitor, or has been on BRAF MEK inhibitor? Just a few of you. All right, so we'll just get you started. So is it the screen?
We also have an online audience.
Oh, that is true, but from the live audience. So some of the objectives today that we'll go over is discussing targeted therapies used in melanoma patients with a BRAF V600 mutation, and to describe the common side effects associated with BRAF and MEK inhibitors, as well as some of the common management strategies associated with that. So the combination therapy. So we have BRAF and MEK inhibitors. This is shown to be a very effective treatment option in melanoma cancer patients, primarily with patients who have a BRAF mutation. And more in particular, this is BRAF V600. It has been shown that by targeting this particular mutation, it slows down the progression of cancer and stops and kills the cancer cells. Later on, adding something called MEK inhibitors has shown to help improve the treatment effectiveness, as well as decrease some of the toxicities associated with BRAF inhibitors. So listed here are the 3 different combinations of the BRAF and MEK inhibitors. We have something called vemurafenib plus cobimetinib, dabrafenib plus trametinib, as well as encorafenib plus binimetinib. So it wouldn't feel complete for me to not talk about some of the drug information as a pharmacist before diving into the side effects. So just going to highlight a few things such as doses and administration. So first with vemurafenib, or also known as Zelboraf is the brand name. Typically the dose is 960 milligrams every 12 hours, and you'd want to take this with a full glass of water. Dabrafenib, or the brand name Tafinlar, is taken as 150 milligrams every 12 hours, and you'd want to take this on an empty stomach. So typically at least 1 hour before a meal or 2 hours after a meal. And then last, we have encorafenib. This one is 450 milligrams taken once a day, and you can take this with or without food. Next, we have the MEK inhibitors. So the 3 are cobimetinib, trametinib, and binimetinib. The doses here, we have cobimetinib, which is kind of unique in terms of how we dose or how patients take this medication. So this one is going to be, you take it on a daily basis, but for 3 weeks. So you take it for 3 weeks, and then it's followed by a 1-week break. So kind of like 3 weeks on and 1 week off. You want to take this with, or you can take this with or without food. So next is trametinib, also the brand name as Mekinist. You can take this on an empty stomach. So again, at least 1 hour before or 2 hours after a meal. This one is a little bit more unique in terms of how to store the medication. The tablets for trametinib, you want to store this refrigerated, whereas the other 5 medications, you can store it at room temperature. Binimetinib as the last one, or the brand name MEK, you take this 45 milligrams every 12 hours, and you can take this with or without food. So what are some of those side effects? So focusing on this, the combination of BRAF and MEK inhibitors do have a wide variety of side effects, and I kind of listed the common ones within each class, but it's important to note that the percentage or the incidence of each medication within the class can vary as well. So some of the side effects that are more common with BRAF inhibitors would be a rash, and typically it's maculopapular, meaning that it could be flat and or it could be bumpy. Fever is another potential side effect, but this is really more associated with the BRAF and trametinib and less common with the other combinations. Other GI symptoms could be nausea, vomiting, and diarrhea, as well as increased liver enzymes. Dry skin or thickening of the skin can also occur as well. On the other side with MEK inhibitors, some of the notable side effects, again, you see rash, but it is a different type of rash. It's more acne-like. Swelling in the hands and the feet can occur, as well as some ocular side effects, such as light sensitivity and blurred vision. And again, these are some of the highlighted toxicities. There are some overlapping side effects between the two classes. So first, focusing on fevers. So fever, it's when your body temperature is greater than or equal to 100.4 degrees Fahrenheit. You may or may not have flu-like symptoms such as chills or night sweats. And again, as previously mentioned, this is more common with dabrafenib and trametinib. If you were to have have a fever, it is very important that you call your doctor and to let them know, because they may instruct you to hold your treatment. And in the meantime, when you're holding your treatment, you can take over-the-counter medications called antipyretics, or known as Tylenol or ibuprofen, and this is to help lower your fever. Drinking plenty of fluids is also very important to help stay hydrated while you are fevering. I like to think of what my mom did to me when I was a kid when I had a fever. So having cold compresses on your forehead and your neck, as well as taking a cool or slightly warm bath. When you are fever-free, at least for 24 hours, your provider might tell you to resume the treatment. And then sometimes in cases of severe fevers or fevers that return or are recurrent, your doctor might say to start low doses of steroids. So that could be something that you may start. So dermatologic side effects. So skin-related symptoms are the more common side effects that we would see with these combination BRAF and MEK inhibitors. So what I wanted to focus on are the rashes, something called plantar palmar hyperkeratosis, as well as photosensitivity. So with rashes, like I mentioned, with BRAF inhibitors, you see macular papular or the flat and bumpy rashes. And with the MEK inhibitors, you see the acne-like rashes. Usually we would preventatively and treat using topical emollients, so Hannah's best friend, Aquaphor, as well as Eucerin, so having those big tubs at the grocery store. You can also take allergy medications or apply topical steroids. So these are some of the things that your doctor might tell you to do, and it just depends on the severity or the type of symptoms you have. Plantar palmar hyperkeratosis. So this is quite worthy, so I'll abbreviate this as PPH. But this is kind of a skin thickening on the palms of your hands and the soles of your feet. So because of this, we like to recommend avoid tight clothing and shoes that can cause friction and pressure on your skin. And this is to help prevent pain from happening. So when you wear tight shoes, it could hurt. So just avoiding something like tight shoes. You can also apply topical emollients, again, Aquaphor or Eucerin, moisturizers, or something known as keratolytics. This could be things like urea cream, if you've ever heard of it. There is a brand that I like to call as Udder Cream. So you'll see like a cow picture on the bottle, and then salicylic acid as well. In terms of photosensitivity, this is more common with vemurafenib. With photosensitivity, it can happen after an hour of sun exposure. So we always recommend wearing protective clothing and applying broad spectrum sunscreen, at least with an SPF of 30. So one of the other potential side effects that could happen is the development of new skin cancers or lesions. This is very rare, but I wanted to mention this so that you all are aware in case you look it up on the internet and you see this, and I didn't mention this. But some of the ones that were reported were squamous cell carcinoma, or more more so cutaneous squamous cell carcinoma. And this is a type of, it can potentially cause an ulcer to form. Keratoacanthoma and skin papilloma are typically nodules or lesions that can grow on the skin, but these are typically benign. It has been found that the incidence of this is really pretty low when you're taking both the BRAF and MEK inhibitors, which you will be instead of taking one of them, the BRAF inhibitors. So typically the percentages that have been reported has been less than 3 to 4%. So it's very important, along with this and the previous slides of other potential skin symptoms, that routine dermatologic exams are done prior to starting the medication, every 2 months, and then up to 6 months after you discontinue. Also, it's important that you do see a dermatologist so that they could be there to help with any potential interventions. So then in terms of cardiovascular side effects, we have cardiomyopathy and QTc prolongation. So what is cardiomyopathy? It's typically when your heart is having a difficult time with pumping out blood throughout the body. So this can occur when there's a decrease in ejection fraction. So essentially meaning that it's a measure in percentage of how much blood is pumping out per heartbeat. So this is something we would monitor using an echocardiogram, also known as echo. So we would want to routinely monitor before you start treatment and during your treatment. Typically, it's 1 month after you start treatment and then every 2 to 3 months afterwards. And then if you do become symptomatic, we will also refer you to cardiology. But for the most part, we will be monitoring the changes in the ejection fraction. And if it is, if there is a decrease from your baseline, then we might adjust or modify your current treatment, the doses, or holding the doses. But it just depends on the grade and the severity. QTc prolongation, so that happens when your heart is struggling or it takes a little bit longer to contract and relax. So this can sometimes affect your heart rhythm. So things that we would monitor would be an electrocardiogram or an EKG or ECG, just to make sure your heart rhythm is okay, and as well as your electrolytes. So things like potassium and calcium. We would treat, or we would want to monitor before you start treatment again, and then during treatment as well. So again, depending on the grade and severity, we would make adjustments with your treatment. There are some GI toxicities as well with the BRAF and MEK inhibitor combination. So diarrhea being one of them. This is probably more common with vemurafenib and less common with the other two combinations. So always, number one is staying hydrated with water, as well as any electrolyte supplements like Gatorade or Pedialyte. There are over-the-counter medications if you've ever tried Imodium, and then there are also prescription medications if Imodium doesn't help. We can consider diet modifications to help decrease the symptoms of the diarrhea. So you could eat meals a little bit more less or more frequently, as well as on a BRAT diet. So bananas, rice, apples, and toast. So that could potentially be something to help decrease the diarrhea. Typically, we would have you continue treatment with the BRAF and MEK inhibitor, but if it was severe enough, we may consider holding treatment until the symptoms resolve. Liver dysfunction or increase in liver enzymes is another thing that we may see. So we will also monitor your liver function test prior to starting treatment as well as during treatment. Depending on how high your liver enzymes could get, we could potentially hold treatment in considering lowering the dose of the treatment. In terms of ocular side effects, so again, this is rare as well. Some of the things that we may potentially see or not see, but reported, is conjunctivitis, also known as pink eye, uveitis, which is eye inflammation, and dry eyes. This is Usually it's managed with topical steroids, and but it's very important that if you do have any changes to your vision, any blurred vision, to let your doctor know so that you should be seen by an eye doctor. Retinopathy and retinal vein occlusion is also potential side effects that were reported. Again, very rare, but things to be aware of. Retinopathy is damage to the retina, whereas retinal vein occlusion is a blockage in the vein that drains blood through the retina. So, for example, for retinal vein occlusion, if we do see that you're confirmed with retinal vein occlusion, that's when we would permanently stop your treatment. So I talked about a lot of dose modifications and interrupting and holding the BRAF and MEK inhibitors. I just wanted to be complete and also include what levels of the dose reduction there are. You can see the BRAF inhibitors in blue and the MEK inhibitors in green. There are typically 2 to 3 dose level reductions before we discontinue the BRAF and MEK inhibitors. However, depending on the grade and severity, it may kind of go all over the place. So in summary, there are various targeted combination therapies used to treat melanoma patients with a BRAF V600 mutation. It's important to be aware of the common side effects and how to manage those side effects and kind of know what to expect in terms of what your doctor may recommend to you. And it's always important to reach out to your doctor and to your treatment team for any questions and with any symptoms that might appear so that we can better tell you what we can do to help. And that's all that I have for you. Thank you for listening.